Good evening, everybody. I'm just going to wait a few more seconds for everybody to come on. Hope everyone is having a wonderful day today. Okay, well, let's get started. Welcome to everyone from around the globe to Dr. Cameron's 6th Lyme Hangout. My name is Candace, and I'll be leading Dr. Cameron's Q&A tonight after his discussion. During this Lyme Hangout, if you have any questions, please feel free to write your comments below this video. Tonight's Lyme Hangout discussion is titled Rage, Extreme Irritability, and Lyme. So let's get started and welcome Dr. Daniel Cameron as he's about to start tonight's Lyme Hangout. Dr. Cameron?
Hello, everyone. I'm here today to discuss a topic that I've known about for years, but I thought I'd look back at where I first started learning these things. If I look back and look back at, I was treating Lyme patients for 3 years. And at that particular time, Dr. Lajigian and his colleagues, which included Dr. Steer, had come up with an article called Chronic Neurologic Lyme. And in that particular article, they had come up with irritability as one of the issues. Candy, so maybe some feedback from your particular microphone. But in this particular book, I was exploring the topic Lyme disease takes on medicine, book that I've been referring to in these sessions. And in this particular paper by Dr. Lajigian, these people were sick for up to 14 years. Many of them had early Lyme, had been treated for Lyme, had been followed for Lyme. And what they presented with now, up to 14 years after being sick, was a whole range of symptoms in addition to irritability. Memory loss, they often had extreme fatigue, they couldn't sleep very well. And even though irritability was one of the emotions that was clearly identified, there was also a lot of other emotions. It seemed almost as if the neurotransmitters that affected mood were all turned up, were activated. They had moments of anxiety, moments of despair, fleeting despair, and in addition to the irritability. They had so much moods that they ended up being wired. They weren't sleeping very well. They weren't able to sleep and concentrate. They also had a broad range of other issues like lightheadedness, which we now refer to as autonomic dysfunction. They had some tingling in their hands and feet, which at the time we thought was purely demyelination, but in hindsight, it may be the neurotransmitters were affected. There were a lot of sensory issues at the time, including hearing loss, tinnitus. And so in that particular paper, I was fascinated by all the things that I was seeing in my practice, that this group had come up with neurologic issues that I thought was really important, and was talking about the kind of patients that I was seeing in my practice. So I wanted to read when they were referring to this irritability. It says here and this is right from their article in the New England Journal of Medicine, they became angry over circumstances that previously caused minor annoyances. Finally, 5 patients had subtle symptoms of language disturbance, difficulty finding words. Several of them couldn't work. And so I thought that irritability was something I would adapt to. And in my practice, I see them, take care of them, but irritability was always common. So later on in my discussion, I'm going to go into a case discussion of irritability. But for now, I thought I'd at least give the background, the scientific background as to why irritability has been discussed for years. In in chapter 78, they had a researcher named Dr. Fallon and some of his colleagues. They had also noticed that there were a lot of psychiatric problems that were out there, that these patients were experiencing. And so irritability was a common problem in that particular paper. In another paper that Dr. Fallon was involved with, this was in chapter 126. This was a 7-year-old girl with a complicated presentation. It was in a paper called Underdiagnosis of Neuropsychiatric Issues in Children. And this 7-year-old was diagnosed with attention deficit disorder. And that's a diagnosis that a lot of people will get. They had troubles focusing in school, yet when you looked at it from a Lyme and Tick-Borne perspective, that whole array of other symptoms. And many of these will be familiar from that chronic neurologic Lyme article. Can you imagine a 7-year-old with lethargy, irritability, forgetfulness, headaches, poor concentration, joint pain, word finding difficulties, light and sound sensitivity? Again, sensory issues. And so there's a lot of kids that are in trouble, a lot of kids that I run into having health problems. It's really easy to just stop at ADHD and not asked about a broader range of questions that are out there. And in this case, after comprehensive workup, EEG, MRI, they had a positive Lyme test by an ELISA. The attention deficit disorder resolved, school grades returned to normal after antibiotic. So instead of just treating symptomatically, the case went on and did well. But 2 years later, the patient came back with being ill again. And the only way she got better again was take another course of antibiotics. She stayed on antibiotics for an extended period of time to avoid a relapse. But at the age of 9, she stopped antibiotics again, stayed asymptomatic, no symptoms for 3 years. Then at 12 years of age, she still developed knee pain, frequent headaches, and poor concentration. Serologic tests now included ELISA and a Western blot. So treatment with oral cefuroxime, which is an oral drug, went well. Now, just to tell you that, these are not just irritability issues. These are broad-based issues. In this chapter, the parents and teacher weighed in on what was wrong with this child. They described trouble with consistency in day-to-day work, careless, heads in clouds, scattered and sloppy work, assignments are late, forgotten or lost, difficulty time following directions, forgetful, disorganized. The parents said Susan would go to school with homework in her bag, but once there had no idea that she should take it out. Emotionally, she was frustrated, overwhelmed, tearful, aggressive, and fearful. So instead of irritability, they're using the word aggressive. She had knee pain, mild swelling, paresthesia, which is burning and prickly feeling. So the workup revealed attention issues like ADHD, but also Lyme issues. And so in this case is that at this point, they decided to treat for Lyme and ADHD. And this made it in the medical literature. And it shows you how easy in practice to take one diagnosis, one problem like ADHD and not look broader than that. It's always a blessing. It's always helpful if you can find a cause. And tick-borne illnesses are so common. Some of those tick-borne illnesses come out and it might look like they have OCD. They might look like they have anxiety, school phobia. They also have some troubles with sometimes with something that looks like neuropsych issues called PANS. It's called pediatric acute neuropsychiatric syndrome, or PANDAS, which is pediatric acute neuropsych disorder associated with strep. That particular disorder and PANS and other names are all supporting all of the neuropsych issues that we're seeing in kids. So I like to talk about Lyme just because Lyme disease is a common cause of neuropsychiatric problems that are out there. And so I think in practice, when I sit down with somebody, it's often easier to see many problems at the same time. When it comes to the mood, I find that many of the moods are rather fleeting. So in the same interview, I might have somebody that's anxious. Then a few minutes later, they might be irritable, angry, normal, or they might be crying without any particular mood to go with it. And what's really important in my practice is that as I look at a tick-borne, I'm also getting history to find out what other psychiatric problems, what other medical problems they have, what are the family dynamics. I usually have the mother and father come in with the child so we can weigh different treatments that have been done, different tests that have been done, and try to decide the right treatment. But I'm always surprised how often, with all the different diagnoses that are turned around and entertained, how often it turns out that Lyme disease is in the picture. And the other thing I always think about is that sometimes you can have two issues. You can have ADHD, and the tick happens to bite them, so they have two issues. Or they have an OCD and Lyme. So I'm always having to tease it apart. I just want to make sure I don't miss a treatable illness. So what I wanted to do is spend a little bit of time on a particular case that I took care of a 9-year-old. And what's different about this case, this is a case that the mother wrote up her experience at taking care of someone with rage and irritability. The mother is Mindy Haber. She's LCSW, CASAC, a licensed psychotherapist in private practice. And I thought she had good eyes and ears for what can actually happen to someone who has Lyme disease. So before I met her in this book called Lyme Rage, you know, she had been to a number of doctors, had had a number of evaluations, and was had been treated for amoxicillin, and for some reason the amoxicillin flared everything up, and whether that was a Herxheimer reaction or that she couldn't tolerate amoxicillin, I couldn't tell. So she was being worked up for a psychiatric admission when she came to my office. So I wanted to tell you a little bit of what she described, because it's unique, because this at least gives you the mother's perspective, not just my perspective at taking care of Lyme disease patients. The mother writes, when we arrived at the office, let me go to an earlier passage in the book first, is that when Dr. Cameron entered, she turned to face the wall. Hello, Dr. Cameron said. He sat down at the desk and tried to communicate with Sophie. Now, Sophie was 9 at the time, but she was angry, discouraged, and fearful. He told me that he had reviewed all the hospital lab test results and paperwork. It was good, he said, that the hospital took all these tests, as it helps to rule out other possibilities. Sophie grew increasingly agitated as the doctor talked to me about her condition, which he concluded, as I recall, was neurologic Lyme disease. As I tried to explain where we were at now, Sophie started moving her wheelchair, banging into the wall of the newly painted office. I tried to communicate with her, but it was of no use. She kept pushing the metal edge of the wheelchair foothold into the wall, creating a dent. I told Dr. Cameron about the recent hospital event and that Sophie had been prescribed Ativan to calm her down. Sophie had her back turned to me and started yelling at the wall, I will never be able to walk again. This is how it'll be for me. No one can help me, not even you. I don't know why we're even here. And as her agitation increased, I feared that she might erupt into an explosion right there in the office and I will not be able to contain. I looked at the doctor and suggested I give her an Ativan, and he agreed. You have to take this. So on the way home, she was extremely agitated also. Now, this was at the beginning of my meeting Sophie. And given the reaction to amoxicillin, given tick-borne illness was a consideration, I picked doxycycline as an alternative. And doxycycline can be used at the age of 9. Doxycycline kills a broader range of tick-borne illnesses than Lyme. It's also useful for Ehrlichia and anaplasmosis. And so we started out with that course. There was another passage I wanted to mention. When she arrived when we arrived at the office, this is a different office. The psychologists seemed delighted to see us. It was not a good time since Sophie had continued to have explosive outbursts and were unable to control them. Her rage episodes were frightening, exhibitions of burning anxiety. Now, you notice I mentioned anxiety. And lately, they had become like a massive, out of control forest fire. She would move from one room to another, banging and slamming, running in circles, screaming and making deep, guttural, rasping sounds that were hair-raising, bone-chilling, and made my skin crawl. My daughter had become a lost child, locked deep inside herself in a place I was unable to reach in to pull her out. Sometimes when she was out of control, her eyes were so dark and empty that I didn't know if she was still in there. So the reason I'm mentioning those is because, as a doctor, I see irritability, anger, anxiety, sadness at different times, different waves. Sometimes the child will express it. But when it's difficult like this, the mother's perspective of not just getting her to the doctor, not just getting to the psychologist, going to all the doctors that she'd been to, she did a pretty good job, a brilliant job of describing what she saw the daughter was going through and what she was going through as a mother. It's a very challenging to have a gifted daughter. Now, with doxycycline, she continued to improve over the next several months. At one point, I switched to Ceftin, which is cefuroxime, and she had the same flare-up she had when she took amoxicillin. So we went back to doxycycline. The father had a lot of troubles at the time with a daughter, beloved daughter, who was having so much irritability and so anxious, and she was only 9. That as she improved, he came on board. The family was united around the daughter. Now, Sophie went on and finished therapy with doxycycline. She was able to gradually get out of that wheelchair. The neurologist never found anything physical, and she was able to get out of the wheelchair, was able to return to school. She first started participating in plays and dancing. So over the next 2 or 3 years, she was quite active in the theater and in the dancing routines. And now she's preparing for college. Her grades are great. I did profile her in a video that's on my website. So if you go into Daniel Cameron, MD, my website, you can see a 2.5-minute video where she discusses that transition from where she was at 9 years of age to being a successful, very active, college-bound child. I was happy that the mother had written the book, Lyme Rage, to capture that particular period of time. Because when I was looking at rage and irritability from the New England Journal of Medicine from years ago, it's not really as alive as what I see in my practice. And reading these sections of the book gives me even more insight into how to share with you out there the rage, extreme irritability. Now, my name is Dr. Daniel Cameron, for those of you who came late. And this particular topic is, I focus on the diagnosis and treatment of Lyme disease. But when you get these kind of issues, I thought it'd be time to spend a hangout and spend time reviewing what it's like to take care of somebody, but also get a little bit of a insight into what the mother and child might go through. Lyme disease is not the only diagnosis, but you'd be surprised how often in an endemic area where there's Lyme, that the neuropsych issues that we see turn out to have Lyme disease as long as you pursue it. You know, I always look for other causes, look for maybe two illnesses at once, but I encourage anybody to not be scared if you see irritability, anxiety, and other moods. Now, I should caution you that lots of times these moods are intense enough that it's easy to say, well, that must be the top priority. Why don't I just send them to a psychiatrist? And if the psychiatrist solve these issues, that is something that this mother did, was try to go the psychiatric route, and it wasn't successful. So sometimes I have to do both. With this amount of psychiatric issues, I might have to do Lyme and psychiatric treatment. There are some kids that are ill enough that they don't have the opportunity to look at Lyme right away. They have enough psychiatric problems that they have to, for their safety, go to a psychiatrist. They might have to get admitted to a hospital. But when they get discharged, it's worth looking a second time as, is it more than a mood? Is it more than a learning issue? Is it more than OCD? Could there be a tick-borne illness that's underneath it all? So I wanted to just start exploring that topic. What I want to do now is to shift to what we've always been doing, is to take some time for a Q&A session or a comment section. So I'm going to be switching over to Candace, who will look at what comments have been coming in, and I'll try to answer some of your questions or concerns. So Candace?
All righty. Okay, so we have the first question. It's from Belgium. First question is it possible that a neurologic Lyme creates rage crisis with self-aggressivity, such as biting and hitting on oneself or scratching oneself at blood without control?
Well, I think that it's a Lyme, as we look at Lyme over time, is that I have to mention that cytokines and chemokines have been identified as part of the process to affect these neurotransmitters. And so you will often get the affective part of these moods, but I often see the physical side, like reaching out, swingings, language problems, swearing, scratching, and or maybe hurting themselves, hurting someone else. And so it's each kid has their own pattern. You know, they're the pan advocates who do research in that area are the pandas and PANS people are seeing also a lot of these behaviors, and they're trying to see what they can do from their perspective. They sometimes use antibiotics, but sometimes they'll use some of the antibiotics that we're talking about for Lyme disease.
All right. Another question is, please address the issues of someone, my daughter with confirmed mast cell activation diagnosis, as well as confirmed Lyme diagnosis. How to even begin to treat Lyme and emotional swings, as here are so many inconsistencies on you to restore immune system and treat Lyme component. Many believe the Lyme infection is the root of the mast cell activation issues.
The field of Lyme disease and all the variety of infections that are in a tick are growing so fast. And with it, one of the topics that's being explored is problem with mast cells. So it's relatively early in the understanding of mast cells. Many of the mast cell activation disorders that are being studied will have some degree of some element of Lyme disease in their history. They'll have often some value with antibiotics, some don't get value with antibiotics. And so the mast cell activation is one of those topics I've been studying, I've been following. I don't think they've reached to enough conclusions yet, but I enjoy seeing splinters where they explore that topic and live and breathe mast cell. But I want to make sure that that's still in work in progress. And so I always think that if there's a chance that Lyme is a factor, I want to get it evaluated. If there's a chance mast cell, many of my patients are starting to explore. If they don't get well, they'll go to someone that's working with mast cell to see if they can get another treatment approach. So the jury's out as to of the overlap of those two diagnoses.
All righty. Another question is, what do you recommend for Lyme patients who have long-term antibiotic herb supplement treatments, how have pretty much recovered physically from the worst of the disease, but yet have lots of disabling symptoms of insusceptibility? But other TDBs cause brain and mental health symptoms like Lyme. Sorry, guys, for the mispronunciation.
Well, I think that you're going to find that antibiotics work quite well for some people. In others, it's actually not so easy. And so if I'm treating someone for a while for Tick-Borne, they will often include a naturopath, a homeopathic doctor, an integrated medicine doctor, someone who can add herbal medicines or chelation medicines. And so I focus more on the allopathic part, the counseling, the staying away from sugar, staying away from alcohol, and it does a great job. But there are still patients who do herbal. Sometimes the 1-2 punch seems to work, some antibiotics. Then they close the deal with herbal, an integrative approach. And that questionnaire that the person asking that question is introducing another topic, which is even if they stop antibiotics, try alternative medicine. If they have TBI, which is traumatic brain injury issues, concentration issues, there's always the question, have they been reinfected? Do they have some unresolved Lyme disease as an infection that they should go back to? Or have they been treated for Babesia? Some people have been treated for a while for Bartonella or Lyme disease, but never anything for Babesia. So anytime there's some lingering issues, it involves seeing doctors to make sure there's no other illness. But it doesn't hurt to go back and look at whether an antibiotic might have been overlooked.
Okay. Another one is, I just wondered about the symptom of suddenly going deaf in one ear overnight. Symptom of Lyme or autoimmune disease?
I wrote a blog. I've been writing a series of blogs called All Things Lyme Blog on my website, Daniel Cameron MD. And the blog I wrote last week was on hearing loss and tinnitus. It was first described in 4 patients in that Legigian paper I talked about earlier in the Hangout. There was a new otolaryngology paper that just came out where tinnitus and hearing loss still occurs. Tinnitus, I find, is actually fairly common in Lyme patients that I take care of. Hearing loss, there's so many reasons for hearing loss. It's such a complex illness. I just encourage more research in what goes on with the hearing, what goes on with the tinnitus in these patients. But it's certainly something I run into fairly often.
Okay, and this is another question from the same person. Also, I just wondered about daytime sleepiness or fatigue. Have you found in your practice that there is anything that can be done to make this annoying symptom move quicker?
Well, I find that during a typical day, somebody with Lyme disease will often wake up like roadkill. They're exhausted. They didn't get much out of their sleep. If they get dressed, get going, sometimes they have to go. They're a mom. They're they're in school, they're at work, they might fade at 2 o'clock. Their extreme fatigue might come at 2 o'clock. And it's so difficult to get through a day. It's almost worse sometimes than pain to have that much fatigue. So I try to help a little by trying to stay away from simple sugars, processed sweets, staying away from alcohol. I try to keep moving. It seems like if I don't get somebody out of the house or don't get off the couch, that fatigue is even worse. So if I can get my patients to get mobilized, try to be with people, be active. Sometimes I can't, but if there's any way to get them out, that helps the fatigue. I find that things like Adderall, which might work for some people with fatigue, doesn't seem to work well when they're that sick when they first present. So I don't have any great remedies for other than that for that debilitating fatigue. Fatigue happened to be the dominant issue in people with chronic neurologic Lyme. It's a dominant issue in all the neuropsych issues. It's something that shows up in chronic fatigue and fibromyalgia. And so I don't think anybody's really has a good idea of how to handle fatigue if it's in the face of this kind of broad-based illness. Thank you.
Okay.
Good question.
Another question is, for this from somebody, someone new. What is the best test for Lyme? She was recently diagnosed with bipolar. She's been sick since she's 14, diagnosed with fibromyalgia, POTS, severe endometriosis, having a full hysterectomy soon, gallbladder removed, kidneys that look like sponges, migraines, frequent hives, low-grade fevers that last weekly. What is the best way to find a doctor who will truly look for the root cause? And what blood test should I have done?
I think that was a great summary of how severe someone can be. It's very easy to be severe enough to be told you have migraines, be told you have bipolar disease, and down the line. Endometriosis is still pretty debilitating, but it's difficult to say where it comes from. And so you can end up going to a number of doctors and having a number of diagnoses, and you run into a situation where are they connected? So that's where we run into in our practice, particularly long histories and physicals and long reviews of medical records, trying to see if there's a tick-borne as part of the illness. So in this case, we usually do a Lyme test called an ELISA, E-L-I-S-A, which is a single titer, a single number, followed by a Western blot. And there's an IgG type and an IgM type. And then there's blood tests for Bartonella, Ehrlichia, Anaplasmosis, and Babesia. Those tests aren't so good because they depend on the immune system. They depend on antibodies in the immune system. We're not measuring the infection. So yes, get some blood tests, but it still at some point involves some clinical judgment. If it looks like Lyme, sounds like Lyme, some doctors relied only on the test and some use clinical judgment. So it's certainly worth a look for a tick-borne, hoping that there's a reversible cause of the illness. So good luck on trying to find a way to get that under control, because it sounds like it all started at a pretty young age.
Okay, another question. What do you think of teasel root?
Well, teasel root, some of my patients take, but because I don't do alternative medicine, it's hard for me to judge response to teasel root, but it's certainly well tolerated in my patients.
Okay. Another person is saying, thank you for your time. My son had terrible rage and twitches at a very young age. After a year of doctors monitoring him, he was diagnosed with Tourette's syndrome. Lived with it through his life and had issues concentrating, as well as many other tics and OCD as well. Her question is, we are presuming it was Lyme all along, as I remember pulling a tick out of his head at a very early age. Is this common misdiagnosis with Tourette that could actually be Lyme?
A good question. The National Institute of Mental Health was seeing kids who had tics, certain, which are movements, Tourette's, which are verbal disruptions, and OCD, and they thought that might have something to do with streptococcus, strep infections. So that's why they call it pandas. The further research on the subject, people said, well, it's not really exactly strep all the time. They don't always have strep, or there's no evidence of strep, so why not call it PANS? What we find is the neuropsychiatric issues that you see in pandas, PANS, and Lyme all look similar. So we'll often run into patients where an antibiotic is a potential treatment. If you just stay with a PANS diagnosis, there's treatments, but sometimes it involves things like intravenous immune globulin. So we don't know if that tick bite in your child at a young age had anything to do with it, but just know that that doctors are divided, and doctors are still trying to work out who might benefit from a tick-borne illness treatment.
All right, and that's for all the questions this evening.
Well, I think that
want
I'd like to again tell you that in case you came in late, I'm Dr. Daniel Cameron. I practice in Mount Kisco. After 31 years of working in the field of Lyme disease, I've been having the pleasure of writing, more time to write the book, Lyme disease takes on medicine, and to be able to sit down with you, share some articles I've been reading, share some of the topics that I've learned over the years, and then having Candice here to help you organize the questions. I'm fighting for Lyme. I'm there for you. I'm there trying to share what I know, and I'm glad for the feedback. So I'm going to turn it over to Candice to close.
Okay. All right. I hope everyone enjoyed tonight's Lyme Hangout. And I wanted to let you all know that Dr. Cameron will be having an event coming up on May 26th at 675 Main Street. There will be games, prizes. Dr. Cameron will also be speaking on something relating to the Lyme topic. And there's also going to be guest speakers there as well. This is the flyer. It will be posted up on his social media accounts within the next day or two. On his Facebook, there will be an RSVP. So if you can, if you're following him on his Facebook, then you will see it posted on there. If not, his Facebook account is at Daniel Cameron MD. Once you log on there within the next day or two, it should be up there. And then you guys can click RSVP. The event will be starting at 4:30, and it should be about 2 hours, I want to say, long. He's also going to have his book there. So you can purchase your book there, have him autograph it, ask him questions, mingle around with others. There's going to be, as I said, activities. It's going to be a fun event. So everybody come out, bring your loved ones, bring friends, bring your kids, anybody that has Lyme. We can all relate, and we can all come together and, encourage each other. So I just wanted to let you guys know about that. Another thing is that the book that Dr. Cameron was speaking about with Sophie, his patient, is called Lyme Rage, and it's by Mindy Haber, and it's located on Amazon. So if you want to purchase that, it's located on Amazon as well. And also his book. Don't forget his book. It's available on Amazon. And if you are around the New York tri-state area, and you want to purchase it with somewhere, I think he has some available at his office as well too. So you can stop in the office and purchase one there as well. Most of his Lyme hangouts that he has discussed so far comes from his book. So it's very informative. And also with his social media accounts, if you guys are not following him, follow him on Facebook. As I said, Daniel Cameron MD, Instagram, Instagram, Dr. Daniel Cameron, and Twitter is the same thing, Dr. Daniel Cameron. And for his YouTube channel, all of his videos, past videos, because since this is the sixth one, there's 5 more other ones. If you guys are new to this and you guys have not seen other previous ones, you can subscribe to his YouTube channel, which is Dr. Cameron YouTube. I think that's the name of it. But if you type in YouTube Daniel Cameron, you'll see it pop up. And just subscribe to that. So any new videos, anything that he posts will automatically come to your email. And I think that's about it. And don't forget, within the next 2 weeks, the next Lyme Hangout, April 24th, same time, same place. So you guys come on over and tune in. See you next time. Bye-bye.
Bye. Thanks, Candace.
You're welcome.